Hi everyone, my name is Sylvia Kulaga and this is case study number 1. So first thing we're going to do is talk about the client. The client is a 6-year-old male. He is in kindergarten and he is in a classroom with all neurotypically developing children. He is diagnosed with autism spectrum disorder and is fully verbal. He receives OT in school 2 to 3 times a week for 1 hour and receives ABA services after school for 2.5 hours, 4 days a week. The behavior that we are concerned at is hitting, and hitting is operationally defined as any instance in which the client hits another person using an open or closed hand with enough force to leave a visible mark or to physically move the person at least 1 foot in any direction. So we want to take a look and see what is maintaining this hitting behavior. During a questionnaire and interview to parents, we saw that the hitting behavior is being positively reinforced, which is what is maintaining it. Positive reinforcement is defined as a response that is followed immediately by the presentation of a stimulus change that increases the future occurrence of similar responses. So for instance, if someone is getting $100 from their parents for every A that they receive on their report card, the next semester they're going to get more A's, which shows that the behavior of getting A's was increased by getting $100 for every A. In this case with the client, we saw that in an instance, for instance, when the client wants access to an item, let's say an iPad, and the access is denied or maybe out of reach, then the client engages in the hitting behavior towards dad, and dad gives client the access to the item or the iPad. So we know that client's hitting behavior is being positively reinforced because when the client wants an item, but the item is denied, the client receives the item after engaging in this hitting behavior, so therefore his hitting behavior increases. The intervention chosen in order to approach the behavior was teaching functional communication. Functional communication training is defined as teaching appropriate requests in order to access a denied consequence, or such as social attention, items, activities, or escape from an aversive activity to decrease any type of maladaptive behaviors. So therefore, we wanted to teach appropriate ways to gain attention, such as asking for help, or asking for a break, or asking for access to an item, such as asking for iPad time, or asking for a snack. And we also wanted to teach first, then statements. So having technicians, Quran teacher, parents use this first, then technique, where with the client, we let them know first we're going to do A, then you can receive B or access to the desired item. So for instance, we would see when the client wants access to a break, the technician would point to a visual break card. Then the client would verbally request for a break saying, "I need a break," and the technician would honor that request by granting a 2-minute break to the client. In order to properly teach functional communication, we needed to know what motivating operations were in place. Motivating operation is defined as an environmental variable that alters, either increases or decreases, the reinforcing or punishing effectiveness of some stimulus, object, or event, and alters, increases, or decreases the current frequency of all behavior that has been reinforced or punished by that stimulus, object, or event. In this case, the client's MOs really varied based on the situation or the setting involved. So for instance, in some cases during times of work or difficult tasks, the MO was being either bored or tired, therefore needing to learn how to ask for a break appropriately or ask for help. In other cases, the client may have had an MO which was being hungry, therefore we would need to teach him to appropriately ask for a snack. Or in other cases, the client may have been bored or wanting to make some sort of craft, in which case we would teach him to appropriately ask for craft materials, or again, ask for a break or ask for iPad time. So here are just some examples where the MO is listed and then the appropriate FCT was taught, such as if the client is tired from working on homework, then the functional communication would be to request a break. If the client is bored and reaching for the craft box, then we would teach to request to make a craft. If the client is hungry, then we would teach the client to request for a snack. And if the client would want the iPad, then we would teach the client to appropriately ask for iPad time. Teaching generalization and maintenance. Generalization is defined as the behavior change that would occur in other places, situation, times, and with other people without having to be directly taught. So for instance, generalization among other individuals, we wanted to see that this behavior change, this functional communication, was being shown with other individuals other than the technician who was directly teaching him these skills. So for instance, using functional communication with mom, dad, or the Quran teacher, or the BCBA. We also wanted to see settings and situation generalization. So the target behavior is exhibited in new settings or situations that were different from the instructional setting. So therefore, we wanted to see and make sure that the FCT was being used in home, in Quran class, during basketball clubs, school, and gymnastics. And of course, we also wanted to make sure that we have response maintenance. So the extent to which the individual continues to have that behavior change after some or all of the intervention has stopped. So for instance, when we stopped prompting the client to use his visual card, we saw that the response was being maintained because he continued to independently ask for a break or ask for help without being shown a visual card. A few outcomes we saw from this FCT intervention was that the client learned to generalize the functional communication. So for instance, he would independently ask for help or even ask for a break during his Quran class without the use of a verbal prompt or a visual prompt. We also saw a decrease in hitting behavior, especially with parents. We saw an increase in functional communication skills and an increase in compliance with tasks from our first then statements. Some obstacles we ran into was finding prompt fading difficult. We saw that fading a verbal prompt was difficult since the client was dependent on needing a full verbal or partial verbal prompt in order to use functional communication. So we therefore changed the intervention to using a visual prompt, which was either a break card or help card, especially during those more difficult times when we saw hitting behavior occur, such as during Quran class when tasks were difficult. We then were able to fade out the visual prompt by slowly removing it from sessions, and the client began to independently ask for help or ask for a break. We also saw some obstacles with consistency across people, so parents versus the Quran teacher versus technician. We saw that sometimes parents were not consistent with using first then statements or appropriately prompting for functional communication, as well as with the Quran teacher. It can be difficult when you are working with other individuals who are not familiar with the program. So therefore, in these cases, what we did was we increased parent training, and we included the Quran teacher in that parent training as well.